My name's Meryl. I'm from Portsmouth. Maddox is our eldest child. He was diagnosed with hypophosphatasie at 10 days old. I had a normal pregnancy. We had the routine scans at 12 weeks and 20 weeks gestation. No concerns at all. And he was born 3 days late. So we went home and we had a difficult night at home. He cried and cried and cried, and he was really unsettled, and he wasn't a great feeder. We didn't have a clue. We spent the night holding Maddox on our chest because that was the only way he seemed to be settled. We did it in like 3-hour slots. And we thought that this was normal and that it was due to him swallowing some mucus during birth and being a bit sicky. But actually it turns out later, it wasn't until his x-rays that they realised that he broke some ribs and his wrist bones during birth. So that was why he was so unsettled and in so much pain. The next morning, he vomited a bloody mucus and we were readmitted to hospital, and they kept us in them for poor feeding, and they inserted a nasogastric tube because he wasn't taking enough milk orally, and then he started to go downhill from there and requiring some oxygen. He became really sick really quickly, and they were talking about ventilating him. So they started doing lots of tests, x-rays, blood samples. They did an ECG and an echo. They thought he had an enlarged heart based on his x-rays because his bones were so small. They came back normal, and then one day 2 new doctors, they came in and they said they thought they had a diagnosis for Maddox. As soon as they told me, I obviously Googled it. I read about how I think it was over 70% of children die before they reach 5 years old if they're diagnosed before 6 months. And obviously Maddox was 10 days old at this point. I read about hypophosphatasie, how it's a lack in the enzyme alkaline phosphatase, so it disrupts the process in mineralisation. So basically minerals such as calcium and phosphorus aren't processed into the bones in the right way, so he couldn't create new bone himself. A few things kind of tallied up. His respiratory effort, he had rickets, so his legs were curved. And he was quite a floppy baby, and obviously he required some feeding. We were always really hopeful that it was just a chest infection, that it was going to improve. Apart from the poor feeding, there was no significant signs that he would have this severe life-threatening disorder. It was devastating for us and our family. As soon as we found out about the trial drug, we were referred to Birmingham Children's Hospital. They knew more about the condition there, and then we had more hope again that Maddox was going to do well, and we never looked back really. Life in intensive care is pretty difficult. You know, I was sat with families that their children had passed away, so to have that around us was difficult, but you get used to it. You know, it took a few days, but you get used to things happening and it just becomes normal. It becomes normal to be around children with weird and wonderful diseases. And it was when I arrived home, that's when I found it really difficult, because it wasn't normal at home and people hadn't heard of hypophosphatasia, and people hadn't really seen babies that are tube fed as well. Living with HPP has become normal for us. He's our first child, so we didn't know any different really, and we've just enjoyed him as much as possible, and you know, initially took it day by day. The impact on me, it meant that I was unable to go back to work because we didn't have anyone else. It's not like he could go into a nursery, and he wasn't able to get one-to-one care until he was 2, so the option of going back to work, well, it wasn't an option for us. I had to stay at home. When Maddox was diagnosed with hypophosphatasia, we started to think about me and Lewis and as being carriers, how it's affected us. I've broke my arm three times. Me and Lewis have both haven't ever had great teeth from a young age. So when we fell pregnant with Ruby, we were seeing the geneticist at the time. It was likely that there would be a 1 in 4 chance of our child being affected with hypophosphatasia. We had some tests carried out early on in pregnancy to determine whether she was a carrier or whether she was affected with hypophosphatasia. Fortunately, she was only a carrier like myself and Lewis, so it was likely that she wouldn't have any symptoms, and if she did have symptoms that would be mild, but I still didn't believe them because she did have some problems feeding initially. So that first day of feeding Ruby just brought me back to how it was with Maddox. But as she grew older, she started doing things at the normal rate, and she is completely different to how Maddox was as a baby at her age. Maddox is really cheeky, he's quite naughty at times, and he's a brilliant big brother to his sister Ruby. He's a fun, loving 2-year-old, and he's amazing.